Welcome to the 8 Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content. Welcome back again to the 8 Minute Rule. I got Mark and Drew with me here, and without fail, we'll go ahead and get things started quickly. So, icebreaker question for you guys. If you had $1,000 show up in the mailbox tomorrow, couldn't spend it on bills, couldn't spend it on debt, what are you spending it on? Drew, go ahead.
Right now, I'm upgrading a lot of the components on my mountain bike, so pretty easily it would go towards that, and I would probably take that and could double it and still not get all what that I want because they're expensive, but I'm looking forward to finishing that project.
$1,000 doesn't go as far as it used to, I guess.
No, it doesn't. Not on mountain bikes.
How about you, Mark? I believe you'll have an answer here.
I have an answer to this one. My wife would probably say it needs to be spent on baby things, but if I could
Practical.
not spend it on baby things, it would probably go towards some exercise equipment. I'm looking at a cable column attachment for a rig, and it's going to run roughly $1,000.
Okay. For the clinic?
No,
Man,
no, for myself.
nice. You got a rig at the house? Good for you.
Yeah.
All right, cool. All right, good stuff. So today, what we want to dive into, we're going to zoom out a little bit at a broader scope of kind of the profession, but even still more in our relative niche space to some degree in the outpatient physical therapy world. And this could apply to a lot of scopes within our fields as well. But really, I want to just look at both you guys have gone through residency, you've gone through fellowship, and so you are definitely the experts to me on who to speak on this. So when we take a broad stance view of residency and fellowship, are they worth it? We're looking at at least $10,000 for each of them, usually a little bit more, not including the time commitments, not including travel, other things you're going to do. So I'd love to get your thoughts. Drew, you want to start us off?
Yeah, I'll start us off. I think it depends what your goals are. If you are someone who wants to have a very structured way to continually prove yourself clinically, that's the route to go. Is anywhere from residencies are typically 12 to 18 months, and you can pack a lot in that amount of time. Fellowships, the course time is longer, but or short, about the same. But if you're like me, you'll take a lot longer to finish it up and get some of the other extra hours. But I do think there's a lot of value. Like in the years or I guess 2 to 3 years while I was really in the bulk, in the meat of the programs, I grew much more clinically than I have at any other time during my career. And so if that's your goal, it's absolutely worth it. And I think the keys would be to make sure you have um, a good program focusing on clinical decision making, things like that, and then really digging into the mentorship piece.
All right, so if you want to grow clinically, I feel like it's absolutely worth it, but big key
Yes.
for you digging into the mentorship piece, absolutely. Mark, what are your thoughts?
Yeah, I think it depends on what you define as worth. Like if you're looking for a straight increase in salary and that's how you define worth, then residency and fellowship are not worth it by those standards. I will say that they both open doors to supplement your salary in other ways, whether that be adjunct work or teaching weekend courses or other ways. But if you're straight up looking for a salary bump, then this is not the way to do it.
I think they even
But to echo what
I think they
what were you
even did a
saying?
study. They even did a study on that, I believe, where the salary doesn't increase based on those finishing the residency or fellowship, but it does open a lot of doors, and you can have a fairly significant increase in salary based on other opportunities outside of straight patient care.
Yeah. But to echo what Drew was saying about quality and what you're providing to patients, I absolutely think that they're worth it. Do I think they're worth it in every setting, meaning like acute care versus skilled nursing versus outpatient? No, I don't know that that makes a ton of difference. But in an outpatient private practice clinic, I think that having those things under your belt definitely adds value. And if as a company and healthcare system, if we move to value-based care, where you're getting paid more or less based on the value that you're bringing to the table, then I think that that is a no-brainer.
So I like that you brought that side of things up. Obviously, we all have to worry about the financial side of things, and when you're making decisions, you have to be factoring that in. And it's hard when you're looking at the immediate gain. Is this going to help profit me in my first year or two after doing it? Probably not, as you're saying. But when you look long term, opening up the doors that you had that you and again, not even looking at we have evidence to show that resident clinicians, fellowship clinicians, you're going to get better results being that kind of clinician, which likely means you're also going to be, in my opinion, less likely to burn out, because to me the biggest thing of burnout is not getting the results that you want to get. But obviously you want to be able to reap the benefit financially. So I guess that brings about kind of another question as we're looking at profession as a whole, potentially shifting toward value-based care. The scope is going to, or the lens is going to fall on physical therapists very much so here in the next 5 to 10 years, I believe. Do you guys think that some form of residency or fellowship should be required within the physical therapist education? Whoever wants to fire away with thoughts.
I think that required is maybe not the way I would put it. And the reason I say that is, again, because I don't know that it should be required across the board. I don't know that someone that going into acute care and working in the hospital, I don't know that they need a full residency training program to do what they need to do. And that's not me diminishing what they do by any means, but they're usually very well prepared to handle those types of patients in that setting right out of school, because a lot of school is focusing on those medically compromised people that need to get moving and how to get them moving and everything safely. Whereas getting into the nitty gritty of like differential diagnosis in an outpatient clinic, where like red flags they're still present, but less prevalent. So compared to acute care, where they also have like MDs, nurses, all this whole healthcare team immediately present and tracking a lot of those things. Where in an outpatient setting, like you're kind of on your own and have to figure things out on your own. So maybe in an outpatient setting or like in a specialized area, I think that requiring it might be worthwhile, but across the board, I don't know that I could say that that's true.
One of the challenges that I feel like I see too, though, is as long as we're going to be a profession that is going to get paid based off of time, Medicare is going to pay for the bare minimum. We don't have a leverage right now to go to Medicare and say that my new grad PT should get paid more for that therapeutic activity unit than my 30-year resident and fellowship trained clinician. So I think if we're looking at ways to make changes on this, it may be one. I think the danger is, do we do the exact same thing that we did with the DPT? And I mean, can we say
Yeah,
that we've gotten a huge financial lift over the DPT? That's a little bit hard to say, right?
yeah. I think I'm glad you brought up that reimbursement one, because I think that's a big piece. If you're looking primarily at patient care reimbursement, that can be a lever. But as of now, if insurance companies are looking at our value based solely on time versus what we do and what we're doing in our heads here and programming and all those different things, and we can't use extenders like physicians can in their practice, then it's going to be hard to say, hey, this is a big win. If we can move outside of that and go to the part where most of our value is like the critical thinking, clinical decision making. And when there's times we can appropriately use extenders, techs, whatever it is that are trained, I think that can be a huge value by having that extra training. And then the other thing that I think the programs do well is teach you to mentor. And so if you have somebody in the clinic that you're trying to train and help out, and you can probably maybe work with them a little bit better as well and mentor them along and getting them to kind of coaching them up to the extender that you would need.
Yeah, I've got another kind of hot take. I think like PT schools often have a lot of fluff, some things that could just be cut out entirely, but then also things where it's like PTs are taught everything from pediatrics to wound care in PT school. But as a profession, if I know I'm not going to go be doing wound care or in pediatrics, Like, why can't we just say, all right, here's your like general PT program. It's 1 to 2 years or something. And then the last year is like, I want to do this. Let me do a residency in this. And that's what you do.
Yeah, that's the model I would love to see. It's more of the physician-based model. Obviously, not as long, but get your 2 years. I mean, we're already doing 2 years hybrid program, and instead of that last year paying tuition to go out and treat patients, actually get some kind of a salary, even if it's reduced, to work into a residency. I think that would be an awesome model that I would love to potentially see at some point.
We need to
Yeah,
we need to stop shooting ourselves in the foot from the inside of a profession as well when we start talking about how this time is such an important thing. If you look at some of the cash pay versus non, and like there's just a competing as a marketing thing, which I kind of get, but at the same time, you're hurting some of our push for getting reimbursed appropriately and being able to see the patients when and where we need to versus having all of these 8-minute rule regulations that limit what we can actually bill and patients we can see and patients we can help. And even from some practice act, like in North Carolina with our dry needling, we have these limitations around who can do it and when and what it takes. And as we keep putting more and more of these regulations and battles here, it makes it harder to really get to where we need to as a profession.
yeah, I think good point on that. Let's send out on a positive note here. Give me at least some thoughts that you guys have, especially as resident and fellowship trained clinicians, and even if not in that space, something that things that everybody can do as they work to improve themselves as clinicians in our outpatient space insurance model that we're using. What are some things that you can really do to continue to create value within your sphere of influence right now?
I mean, I think that the way that I communicate has changed so much since going through residency and fellowship that the way that I communicate with my patients is just so honed in that like it makes a memorable experience for them and they're like, holy crap, this guy's locked in. At least that's what I hope they think. And then like they tell people about it. So I'm taking that impact from this one person and then my reach is then to their immediate friend group or their family or whatever it may be that they're then communicating that with.
I think similar, it goes back to that be the change you want to see. So start being that provider within the legal rules, right? So you still have to follow whatever Medicare guidelines say we have to do, insurance say we have to do, but like be the one who makes that big change. Talk about those different things with your patients and recognize your value within that healthcare system. Talk to physicians because the more you talk to physicians, they really do understand the value of PT. I think we're one of the biggest, the best values in PT. Like we really are able to spend time with the patients. There's not any other healthcare profession really that does what we do. And I think they recognize that value. So the more that you can build that value right now, hopefully insurance companies start to recognize it and just start here with you.
Yeah, I love it. Everything is sales. And if we're going to have time where we're talking with our patients during their session and even just dropping little pearls about that as well, too, kind of recognizing where they've come and, um, you know, how much they actually have saved in terms of working with us. So I think continuing to educate along those lines in our clinic, in our community, and working in that space is something we can do. All right. I appreciate it, guys. Until next time.